and then hopefully see some of the outcomes of the patients that we have done it with.
Is this surgery? 12 million Americans suffer from back pain, so there is bound to be a great deal of interest in the internet broadcast. It takes place Saturday, June 26th at 1 p.m. You can watch the surgery by logging on to tcpalm.com.
Thank you, Andre. Today, now any of us who are parents know that, especially if you have a toddler like little Bobby is, 2 years old or even older than that, and they're out there in the playground, monkey bars, Daddy, monkey bars, everything. He just wants to go from one thing to the next, and they go at breakneck speed. Well, they can get hurt that way. But today, we have a special guest with us who can tell us how to make sure that they don't get hurt when they're out there, or at least give us some tips on it. He is a local neurosurgeon. He is Dr. Charles Theofilos, and we appreciate him coming and taking time to give us some tips on this. It can be a big problem, can it, Charles?
It can, and especially for the younger children. If they go to the playground unsupervised, they could go, as you say, go crazy. And they can fall and hurt themselves.
Supervision, I guess, is the thing you talk about the most. That's the key, is making sure you're there with them.
Especially for the younger children that can't think for themselves as of yet. It's important to be there and show them and catch them if they fall. For the older children, it's important to teach them how to be safe, teach them the protective gear that may accompany a certain sport or playground activity.
Give us a couple of examples, can you?
Rollerblading.
Oh, there we go. Roller, even for the adults.
Even for myself,
Yeah.
I get loaded up with protective gear. I have my helmet. I make sure my helmet fits nice and fit, elbow pads, wrist pads, and if I fall, I learn how to fall properly.
That's interesting. If you fall, you learn how to fall properly. How does one fall without hurting yourself, or at least reducing the risk of injury?
That's important. We try to reduce the stress to a certain area of the body, and I was taught that in football camp. When you fall, you roll out of a fall. You spread the impact over a large part of your body instead of just one part.
Okay. How about now young kids, especially, I know this, when I take little Bobby he wants to go in the swing, he wants to go to the monkey bars, he wants to do everything. They seem to act or react without any fear of anything. Is there a way you can instill something in them that would keep them doing that?
I haven't learned that secret for my children yet. They are fearless. You just have to be around them and constantly supervise them, and hopefully eventually they'll learn how to be safe.
Okay. You were talking about gear. Is there anything that people can do with toddlers? Have you ever had to install certain types of safety gear with toddlers who are out playing around?
I haven't done that yet. I mean, we can't ask our toddlers to walk around with helmets at all the time. We just have to, hopefully when they fall, they're going to have accidents. If they have accidents and they seem serious, stay with the child, have someone call 911, let the rescue team see them, examine them, and take them to the appropriate facility.
If your child, this can happen at home too. The child falls, hits his head, and is it true that you shouldn't let a child take a nap after he's had a rather hard hit on the head? Is that true?
Well, you want to watch the child to make sure, number one, that he remains conscious. People say don't let them take naps because if they lapse into unconsciousness, you can't see that. You want to wake them up frequently, make sure they wake up okay, make sure they don't have any protracted nausea or vomiting or act unusual.
Is it good to see if their eyes are dilating too?
Make sure the eyes are equal, but make sure they were equal before they fell. It's always important to know that.
That's a very good point. That's a very good point. Doctor, thank you very much for the tips. We appreciate your help, and hopefully you'll come back and give us more another time.
Thank you.
Dr. Charles Theofilos, local neurosurgeon, with some safety tips that all of us that have toddlers need, I'll tell you.
With all that in mind, how do you prepare for the worst, the possibility of another terrorist attack? The fear factor has many rushing out to buy gas masks. Others are stocking up on supplies, and a local doctor is building an arsenal in his medicine cabinet. Our story tonight from News Channel 5's Shannon Kaye.
Gas masks. Thousands now scrambling to buy them, despite warnings from experts.
The use of the gas mask would be of no use. Most people would have no awareness that they have been exposed to any biological substance, and therefore they would not be able to use the gas mask.
But Americans are buying them anyway. Concern about a biological or chemical terror attack evident even here in Palm Beach County. These charts sent to all local doctors offering tips in diagnosing and treating exposure to things like anthrax and smallpox.
I'm proud of the Palm Beach Medical Society for letting the physicians become more aware about what we need to do as physicians to to take care of our patients as well as the public.
Dr. Charles Theofilos, a neurosurgeon in Lake Worth, relieved to have these charts.
In the end, if this doesn't make any difference, I tried, but I'll never forgive myself if I did nothing and something happened and I could have done something.
But for the average family, stocking antibiotics can be costly. $5 a pill for Cipro, the cure for anthrax exposure. Some worry if taken in advance may build a tolerance, making them useless when they're really needed. But Theophilus, not preaching fear, but awareness to his patients and his loved ones.
I'm not going to let them win by making me live my life in fright. But my family's going to be educated. They're going to be prepared, at least to the best of our abilities, and I'm going to do everything I can to have my patients prepared if anything happens.
Shannon Cake, News Channel 5.
For more information on how to diagnose or treat exposure to certain types of biological or chemical weapons, you can log on to our website, WPTV.com.
The Medical Knowledge Corporation presents The Patient's Guide to Cervical Spine Surgery. This video presentation will answer the most common questions presented by patients who are considering cervical spine surgery. We will review the process you have undergone to reach this stage in your treatment, what to expect after your surgical procedure, and instructions for your recovery. Please review this presentation thoroughly, along with the information and instructions given to you by your surgeon as you take the next steps towards a healthy lifestyle. Before we discuss the operative procedure itself, let's review the process by which you and your surgeon have decided that surgery is indicated for your condition. Let's meet Charles, who has experienced many of the same challenges that you have. Charles remembers that simply turning his head was an agonizing experience.
My neck pain and arm was making life miserable. My work was suffering. I even had to give up the things I enjoyed, like fishing with my son.
Common symptoms associated with cervical disorders can be one or all of the following. Pain in and around the neck region. Pain which may run down your arms and or legs. Numbness and or weakness in your arms and or hands. Bladder and bowel control problems. These debilitating symptoms can appear suddenly from a related accident, as they did with Charles, or they can occur gradually over time from degenerative or arthritic conditions. However, when they occur, we know how miserable they can be and how important it is for you to resolve them. That's why you have gone through a number of tests and exams to best determine the cause of your pain and how to remedy it. A quick review of the cervical spine's anatomy will give you a better understanding of your condition. The cervical spine is made up of 7 bones called vertebrae, or vertebral bodies. The uppermost vertebral body is the atlas and is often referred to as C1. The C2 vertebral body is the axis. The remaining 5 vertebral bodies are very similar and are separated by the discs, which act as shock absorbers. These are referred to as C3 through C7. The spinal cord runs down behind the vertebral bodies and is surrounded by bone that extends from these bodies. The nerve roots exit the spinal canal on both sides and at each level. This intricate and complex structure is surrounded by many soft tissues that include muscles, ligaments, tendons, and fatty tissue. Now that you have a basic understanding of your neck's anatomy and the symptoms that have occurred, let's review the methods used in diagnosing your condition. Like Charles, you started with a thorough physical exam by your surgeon, and then may have had one or all of the following tests ordered. X-rays. X-rays show the bony structure of the neck. They can be the first step in determining any irregularities that may be causing problems. MRI and CAT scans. These show the bones and soft tissues surrounding the spine and can help determine things such as disc herniations and bone spurs. These images are often used in conjunction with X-rays. EMG nerve conduction velocity studies. These tests help to determine the extent of any nerve damage that you may have. Myelograms. This test places a special dye in your spinal sac, and in conjunction with X-rays, MRIs, and CAT scans, the spinal nerves are highlighted to determine abnormal areas. These diagnostic tests, along with your physical examination, allow the doctor to accurately diagnose your condition and recommend the best course of action to be taken for your recovery. Charles wasn't surprised to hear his diagnosis of a disc herniation.
I knew it had to be more than a pulled muscle. When the doctor told me I had a disc herniation, which was pressing against the nerves in my neck, it made sense. Once they found the problem, I just wanted to get it fixed.
Like many patients, you may have gone through a conservative treatment approach first. Conservative treatments include physical therapy and rehabilitation in conjunction with medications such as anti-inflammatories, muscle relaxers, or epidural injections. In some cases, this may be all a patient needs to return back to his or her normal routine. However, in other cases, a patient like Charles may have to stop conservative treatment early or skip conservative treatment altogether and proceed with surgery as the only alternative for recovery. Like Charles, you have been diagnosed with a condition that requires surgical intervention as the next step. These conditions can be one or more of the following. Disc herniation. Disc herniation occurs when the integrity of the disc has been damaged. Typically, the damaged disc places pressure on either the spinal cord or the nerve roots, which branch off from the spinal cord. Spondylosis. Spondylosis is a condition where bone spurs form around the disc space, nerve roots, and/or spinal canal. Spinal stenosis. Spinal stenosis is the narrowing or constriction of bony passages that surround the nerve roots and/or the spinal canal. Spondylolisthesis. Spondylolisthesis is a forward displacement of one vertebral body over another. Spinal instability. Spinal instability describes a general laxity of the ligaments surrounding the vertebral bodies. These conditions can cause pressure on the nerve roots. This pressure on the nerve roots and its associated symptoms is called radiculopathy. Radiculopathy can cause pain and/or numbness in the neck and possibly down your shoulder, arm, and hand. These conditions can also cause pressure on the spinal cord, which is called myelopathy. Myelopathy can cause pain and weakness in the arms and legs. Myelopathy may also cause stiffness in the extremities as well as a loss of bowel and bladder control. Any or all of these conditions may require surgical intervention. The goal of surgery is to accomplish three main objectives. Reduction, which restores the spine back to its natural alignment. Decompression is the removal of damaged disc material or bone spurs that are pressing on the nerve roots and/or spinal cord. Stability, which is the stabilizing of the spine segments, usually through fusion, which eliminates unwanted motion. All three help in eliminating the symptoms described earlier. Charles was at first reluctant to have surgery, but remembers what life was like before his injury and wanted to get back to a normal way of life. He was confident that his doctor had thoroughly explored every avenue of diagnosis and treatment.
Anytime you hear the word surgery, you get nervous. But after I had spoken with my doctor, I realized that it was the best way for me to get my life back on track.
Like Charles, you have reached the point where your surgeon has recommended that surgery may be the best option in treating your cervical problem. Please remember to always follow specific instructions given to you by your surgeon and the hospital prior to your surgical procedure. The following are some of what you may expect. You will be instructed by your surgeon concerning any alterations in your routine medications, if any, prior to surgery. Discontinue all nicotine products because nicotine may slow down the healing process. Limit your vitamin intake to a multivitamin, although you may take extra vitamin C. Eliminating alcohol consumption is also recommended to avoid surgical complications. Please remember, with any surgical procedure, complications may occur. These complications may include pain, weakness, numbness, advanced degeneration above and below the operative level, paralysis, loss of bowel and bladder control and sexual function, stroke, death, anesthetic risks, blood clots, swallowing and speech difficulties, damage to your trachea, esophagus, and/or carotid artery, broken plates and screws, and a failed fusion. If you choose to have donated bone, you risk the chance of contracting AIDS or hepatitis. If you use your own pelvis bone, there is a risk of infection, fracture at graft site, hematoma, numbness of the legs, and chronic pain at the graft site. Some of these risks may lead to the need for additional surgery. This list is not all-inclusive, and, as with any aspect of your surgery, any questions you may have about these complications should be fully discussed with your surgeon before your consent for surgery is given. Earlier, we highlighted the basic indications for surgery on the cervical spine. Now, we would like to show you briefly what your surgeon will accomplish during surgery. Your surgeon can approach the cervical spine by two different methods. The first approach is from the front of the neck. This is called an anterior approach. Your surgeon will make a small incision along the front of your neck to access your cervical spine. This procedure is a very common and safe way to remove part or all of the affected disc or bone spurs, which will relieve pressure on the nerve roots and/or spinal cord. Once the disc is removed, your surgeon may perform a fusion of two or more of the cervical vertebral bodies in your neck to stabilize the area. This is the procedure commonly called an ACDF. In a fusion, the disc is replaced with bone from either your pelvis or donor bone from a bone bank. Plates and screws may be used to add further stability to the region. This will allow the two cervical vertebral bodies to fuse together and form a solid and stable spine segment. In some cases, the entire vertebral body and disc are removed and replaced with a bone graft to relieve pressure on the spinal cord. This is called a corpectomy. Plates and screws may also be used in this procedure to further enhance stability. For some patients, the surgeon may decide that a posterior approach is the best way to accomplish the surgical goals. In the posterior approach, the surgeon enters from the back of the neck rather than from the front. The surgeon may perform a cervical laminectomy, which removes part of the bony covering of the posterior cervical spine. This type of decompression creates more